to our another session of Venus Ask. Venus Ask is our engagement platform where we share excellent and prominent work our employees have been doing at Venus. It's a platform where they can share how it is to work at Venus. So today we have with us Dr. Javed Akhter from Pre-Clinical Department. So let's hear from him now. Hi sir, a very warm welcome to you. So let's begin with a quick introduction of yours.
Thank you, Ms. Divya, for inviting me on this wonderful platform of Venus Art session. So, I am Dr. Javed Akhter, working as a research scientist in Venus Remedies Limited.
Okay. So could you please tell us something about your previous work experience and how it has shaped you as a working professional?
After doing my master's in biotechnology from Jiva University, Gwalior, I started working in CSIR, Indian Institute of Petroleum, as a research fellow in the biotechnology conversion area. Then after I qualified Indian Council of Medical Research JRC for PhD program, and I joined IIT Roorkee for my PhD program under the supervision of Professor Ranjana Pathania in the Department of Biotechnology. And then I completed my doctoral degree in 2021, and after that I joined Venus Remedies Limited as a research scientist in preclinical pharmacology department.
Well, thank you for answering that question, sir.
Thank
So, as you mentioned that you are from preclinical department, so could you please give an overview of the preclinical research process?
Preclinical pharmacology or toxicology generally department works on animal-based model study of novel molecules or novel formulations in the whichever is in our developmental pipelines. So right now we are using rat models, mice model to work and develop our pharmacokinetics data, pharmacodynamics data, and efficacy study data, which that data generally support our clinical studies further. And we are also working on different wound care model as well, including pain management as well in pharmacology department. So overall, different kind of work we are doing preclinical pharmacology.
Well, that's great, sir. Okay, so what sort of technologies or methodologies your department uses in preclinical research process?
Right now, we are having a well-established preclinical pharmacology and toxicology departments equipped with latest cutting-edge instrumentations, where we use cutting-edge scientific technology like biochemical analysis, histopathology, including molecular biology, some sort of techniques, ELISA, to find out and develop a robust pharmacological data and toxicological data. We generally support our further clinical study of our developmental products.
Oh, well, that's great, sir. Okay, so how do you maintain the safety and efficacy standards while performing the preclinical trials?
In case of safety maintenance, we have sophisticated guidelines. We follow that SOPs. We use generally protective equipments like protective sunglasses, head cover, apron, gloves as food cover, all this to protect our self and all the working staff in the preclinical pharmacology department or including animal house work, so that they can't get any kind of zoonotical cross infections. And after that, after performing the experiment, we generally collect all the waste materials and we put it in the designated dustbin we are having as per the guidelines of the state pollution control board. And the person comes from the state pollution control board and they collect that waste and they dispose of according to their own guidelines. So these are the methodology we use generally to keep the environment of our working lab or animal house clean.
Oh, well, that's great. Okay, so I'm very sure while performing the preclinical trials that there will be many sort of challenges as well. So what are the sort of challenges you guys face and how do you address those?
So as we are working in preclinical, I must tell you, is an integral part of
Yeah.
clinical study or drug development process. So before going to the clinical study of novel formulations or novel products, we have to perform the safety study of that molecules, plus develop a strong, robust pharmacological data that might support and mimic the human conditions. So that's why we are using small rodent models like rat, mice, rabbits, and after developing that data, we analyze the data, and after analyzing, we provide that data to the clinical department for further process, and that's how we are working in the preclinical pharmacology to develop different sorts of pharmacokinetics, pharmacodynamics, plus correlation between pharmacokinetics and pharmacodynamics, safety as well, which includes a toxicity study of small molecules or novel chemical entity. I would like to give you a short and picture about the PK and PK. What is PK and PD for the audience? PK is a pharmacokinetic generally, how body reacts against the drugs.
Okay.
That is called PK. And how drugs acts on the body
Okay.
against the
So these
pathological
both are
condition.
different things.
These are about PD is how your molecules, your compound, your drugs, your medicine works on your body, and the PK in response to that, how
How
your
our
body reacts
body
to that, how
responds.
you metabolize and eliminate from the body, because in excess condition everything is harmful, so they have to be metabolized and they clear out from your body after certain period of time. So this kind of correlation we have to study, and we work on that.
Well, thank you so much, sir, for explaining this in such a simple manner. Okay, so let's proceed to the next question. So, what do you think? How do you see that preclinical trial will evolve in coming 5 to 10 years, and how it is going to benefit Venus in the longer run?
So in Venus, we have a well-established R&D facility with latest instrumentation and technology. Or we are having a well-equipped and a large animal house facility, having a different sort of instrumentation over there. Right now, we are also working on certain different sort of clinical study. We have introduced different instrumentation in animal house facility and pharmacological department as well, to sort out our problem, and further to cope up with the pace of global requirement. So as I mentioned earlier that preclinical is an integral part, so it must go parallel with the clinical study. Until unless we don't provide a robust preclinical data based on the animals model, we directly cannot go directly jump into the clinical trials on a human subjects. So as far as preclinical future, it has immense future, great futures ahead, and it will remain, because if without preclinical study we cannot move on further for the clinical trials. So as a Venus, we are targeting for the global R&D. So that's Venus has a great opportunity as well, and preclinicals will remain an intact part of the Venus R&D system.
Well, thank you for answering that question, sir. Okay, so let's jump on to the next question. So, as you have completed 2 years at Venus, so how do you describe your overall journey? What were the learnings?
So Mr. Divya, I would like to express. I would like to thanks Venus Remedies Limited and its management for selecting me for the research scientist positions. Initially, I applied for RA position over here through Naukri.com, but fortunately, Venus has transformed that position to her research scientist positions. When I joined Venus, I found the work culture is very nice, very good. Depart in the department, out of the department, like entire VMRC or entire Venus family, people are very nice. Work culture is very nice. My senior, Mr. Kamlesh Kumar Vishwakarma, Mr. Satish Kumar, Dr. Anmol Bhist, he's a pathologist. Mr. Kamlesh Kumar Vishwakarma is a senior research scientist. He's just up to me by standing in this organization. So really, he has lots of experience working in different fields of preclinical department. So all of them are helping me and supporting me in a different sort of way. So it has been a wonderful experience joining Venus Remedies Limited, and I wish to continue my journey ahead as well.
Well, thank you for answering that. Okay, so let's jump on to the next question. So as you must be aware that every department in this organization, they have a mission 2025 assigned. So what is like your department's mission, and how are you like planning to achieve it?
So we are having a point guidelines for mission 2025 of to excel in the department and execute in the department. So I would like to give a short pen picture about that. One is the technological advancement of our team members of the department through augmenting their technical skills, social empowerment plus economical empowerment. Apart from that, we have a mission to develop novel methodologies, design standard SOPs, and we follow through according to that. We are having missions of developing novel infectious models in a small animals models. Apart from that, we are progressing toward the development of robust pharmacological and toxicological in vivo data, which generally supports our clinical trials of our developmental products in the pipeline. Apart from that, we are also targeting to publish at least two research papers in peer reviewed journals every year. Apart from that, we are also targeting to foster the antimicrobial therapy in this crisis of time, which is taking much of life in terms of numbers, not only in developing country, even in the developed country like USA. And it has been estimated that it's going to be a 10 million cost of lives by 2025 and 100 trillions of economic loss around the globe. So we are facing a huge challenge, and we are working on that to mitigate that problems through different methodology.
Well, thank you so much, sir, for explaining this in such a simple manner. Okay, so at last, do you have any message for the current generation who is looking to join Venus or join this field?
I must tell to the audience who are watching us, because Venus is a good place to work. It has been accredited 3 times in a row as a great place to work. Having a good work cultures, you will get a wonderful colleagues who will support you in every sort of corner wherever you need. We are having a great opportunity to work in different areas of research. Because we are having well established R&D sector, we are also looking to enhance our or expand our R&D sector at a global level. So young brain who want to do research in the field of preclinical pharmacology, toxicology, and molecular biology or microbiology, they are welcome and encouraged to join Venus Limited, and you will love it. I must tell you, you will love it.
Well, thank you very much, sir. It was such an insightful session. So we will be back with another session of Venus Ask, where employees will be sharing how it is to work at Venus, which is a great place to work. Thank you.
Thank you very much.